Hi there, thank you for joining me. Lovely to see you all, and thank you for inviting me to present this today. It's a real honour to be here, thank you. Okay, so I'm going to attempt to share my screen. Let's see how this goes. Just bear with me 1 second.
Right.
There we go. Okay. Right. Okay. Right. So I'm going to run through a few slides first of all. So a little bit about me. As Annie introduced me, I'm a clinical exercise specialist, clinical Pilates teacher and cancer rehabilitation specialist. I've got 30 years experience in the fitness industry, and I'm also the author of a book called The Bowel Cancer Recovery Toolkit. I am deeply passionate about exercise and movement and rehabilitation for people who are living with cancer, and particularly for people who have any kind of abdominal cancer, and particularly people who've had abdominal surgery. So that's my kind of real deep passion. I myself went through abdominal surgery for stoma surgery 10 years ago, and I really struggled to find information about what safe exercises I could do after my surgery. So that's made me kind of really determined to try and support people going through the same thing. I'm a runner myself. I've kind of managed to get back into doing all sorts of things, and I've just actually completed my 43rd marathon. And I'm also really thrilled at the moment to be delivering the weekly exercise classes for Overcome on Zoom, which has been really lovely, and I've been really loving that. And I think a few of you, I'm recognizing some faces from a few of you who are joining me, which is lovely. So I'll talk a little bit less about me, and I'm going to talk about what I'm going to talk about. So I really want to talk about the importance of exercise for people living with a cancer diagnosis. And the first thing to say is exercise is safe before, during and after treatment. And I'm going to talk a little bit in a minute about what actually we mean by exercise, but the most important thing you need to know is that it's safe for you to be physically active wherever you are within your treatment and your cancer journey. In fact, it's more than safe, it's actually an essential part of treatment and recovery. And in countries like Denmark, anybody who has a cancer diagnosis is actually referred directly for exercise therapy as part of their treatment package. Now, we don't have the luxury of that here in the UK, but if there is a way for you to access some kind of specialist exercise program, then that is amazing. So please look out for those if you've got any access to anything like that. It can help to combat side effects of your treatment, and also helps in terms of rehabilitation after your surgery. Reduces the risk of recurrence, and that's particularly in breast cancer, but across all cancers actually. So, and the reason for that is because exercise has an anti-inflammatory effect on the body. And cancer cells really like a body that has a lot of chronic inflammation in it, and that's where they grow in the best way. So if we can reduce that chronic inflammation within the body generally, we're going to reduce the risk of recurrence. So, you know, it's part of the kind of package of kind of thinking about your treatment as a whole. So it may actually help your body fight the cancer and aid the way in which you can tolerate treatment. So it's a hugely, hugely powerful tool. And of course, probably for me, I think one of the most important things is it helps with mental well-being and this kind of sense of control when you're in this situation dealing with treatment and dealing with a cancer diagnosis where everything is out of control and you don't feel like you've got any control over anything. I just want to check that my slides are working correctly. Annie, if you just give me a little thumbs up if they're working through. Okay, because they sometimes skip a bit and a bit naughty. So I like to think of exercise as this kind of wonder drug for anybody really, but particularly it becomes more important for people with a cancer diagnosis. And we're starting to receive loads and loads of research an amazing high quality research about just how important it is. So in terms of kind of the benefits, we've got improved mental well-being, reduced stress, helps with depression, and helps us sleep. And sleep is one of the most important things we really need to think about. So we can sort of think about it as this like jigsaw puzzle. You know, it's a really, really powerful part of that puzzle. Helps maintain muscle mass. So I'm less bothered about weight. Actually, I'm more bothered about muscle mass. So, and one of the things I talk about in my class, and I teach in my class that I do for Overcome, is strength training. And it's so important to sort of maintain that muscle mass. And if you're going through treatment, you've probably noticed already, maybe you've felt like you're losing muscle. And if you've had surgery and you've been in hospital, again, muscle loss is really rapid. We lose about 10% of our muscle in 10 days in hospital. So maintaining muscle mass is super, super important. Helps with quality of life, with our confidence in our body, but also in our general well-being and social interaction. And if you're able to access some kind of exercise in a social setting in a safe way at the moment, then that will be even better. And of course, it helps to reduce other chronic diseases such as diabetes, heart disease, and other cancers. And most importantly, probably for people who are dealing with a sort of hormone-related cancer, reducing the risk of osteoporosis. And that links with our muscle mass. So that's why strength training is so important. Reduces the risk of falls and arthritis as well. So how much physical activity should we be doing? The kind of World Health Organization guidelines say we should be doing about 150 minutes per week of some kind of moderate exercise. Now that's about 20 minutes per day. And that could be 20 minutes of brisk walking per day. Now that's for the general population. The actual guidelines for people going through treatment or going through active treatment or living with cancer are about 30 minutes 3 times a week, or as tolerated. So the general message is anything is better than nothing and anything is beneficial. So don't get too hooked up on the 150 minutes, because actually that feels like quite a lot. If you just exercise once a week, then brilliant. The pandemic, unfortunately, has had a massive effect on sort of exercise levels generally. So we've seen this kind of drop in activity levels generally, kind of lower motivation. There's less opportunity for people to be active, and people are very cautious about returning. So that's why the Overcome class have been so great, because it's on Zoom, people are in their own homes, it's safe environment, there's no sort of risk in terms of mixing with other people, particularly if you're having chemotherapy or you're having treatment. So that's a great way to come and exercise in a safe way, where it's safe and appropriate. But you know, I do other sort of groups for people, just general running groups, and we've seen a real drop in attendance even still now. So I think people have just really lost confidence and lost motivation just generally. So it's a little bit harder. And of course, when you're dealing with a diagnosis of cancer and going through treatment and surgery, it's even harder. So that level of motivation is really not there. So I want you to just reflect for a moment. And you might just want to think about this in your mind, or you might want to come back to it a little bit later on. When you hear the word exercise, what do you immediately think of? Do you think of going to the gym? Do you think of going out for a run? Or does it mean something different to you? And what is your relationship with exercise and your activity history? And how has your cancer diagnosis changed that or affected that? And for some people, they become more active. For some people, they become significantly less active. So just reflect on how that has changed, and also how you feel about exercise right now. Is it something you feel you could access? Is it something that you don't feel is for you, or are you very nervous about it? And I'm going to take some questions at the end, and we can talk about all of those things then. So just sort of reflect on that. And maybe come back to that a little bit later as well, maybe later on the day as you're kind of reflecting on this talk. So we all have fears and worries and barriers about exercise. I don't have time, the weather's a problem, I'm too tired, I've got a medical condition, and that might not be cancer, that might be arthritis or a knee problem or something else. My knees hurt, I haven't got facilities, I'm not enjoying it, I can't afford to go. I can't afford the gym membership or trainers. I hate going to the gym. I don't know what to do or how to start. I don't have the willpower. Is it even safe? And I've been told to take it easy or rest. And that's a really common message that we get from healthcare professionals, is to just take it easy. And also the people around you, maybe within your family, often those messages, people don't want to see you pushing yourselves. They don't want to see you struggling. So rest, sit down, rest. And actually that's the wrong message. What we need to be doing is encouraging people to move and encouraging ourselves to move. So you might recognize some of those fears and worries and barriers yourself. They're very common in everybody. And when we have a medical condition and we have cancer, those barriers become even bigger. So we need to try and unpick them. And we need to try and understand these barriers and then try and work around them, work through them. So let's look at kind of, if you've had surgery particularly, or maybe you're still having treatment, it sort of doesn't really matter. But what we often think is we have this process of treatment, we have this process of surgery, and then we come through it. And then what we expect it to be like is this linear pathway, and it's nothing like that. We have bad days, we go back a few steps, we go forwards a few steps, then something happens and we're knocked back again. And it can feel really frustrating. People around us are saying, oh, you're getting better, or you're making a recovery, or how are you getting on with your chemo? Is it over? And people maybe expect us to bounce back, and that doesn't really happen. And, I certainly know from my experience, when I had my surgery, I got super frustrated. And if somebody had put this graph in front of me and said, it's not linear, it's okay for you to go back a few steps, that would have felt like it was much more normal for me. So don't beat yourselves up if you don't feel like your recovery, in inverted commas, is going in the right direction, because actually it goes back and forth, and that's normal and that's okay. And we have to kind of learn to roll with that a little bit. So just looking at the guidelines, just to be sure that you know exactly that I'm just not making this up. So the American College of Sports Medicine Guidelines, the ASCM, are kind of the gold standard global guideline writers, if you like, for exercise and medical conditions. So historically, clinicians have advised people with cancer to rest and avoid activity, and you may have even given that message yourself. However, we know that that is seriously outdated. And to the extent that you're able, people should try and adhere to guidelines on physical activity. So coming back to that 150 minutes of exercise per week, or 30 minutes 3 times a week, or really do what you can when you can. And that's the message. So we shouldn't be avoiding exercise at all. We need to be thinking about ways in which we can be active in a safe way. Because we've got all these amazing benefits: reducing fatigue, reducing our risk of osteoporosis, improving our mental health, improving our confidence and self-esteem, reducing risk of lymphedema, improving insomnia, improving muscle loss, weight changes, surgery, body image. The list goes on, and it just helps you feel better. I see people come to the class that we're doing on Zoom, and I know that it's taken a lot of effort to get there. People don't feel like it. They think, do you know what, I'll just have a day off. I don't really fancy it today. They come, they move a little bit, and I see them visibly look better by the end of it. They just feel brighter, and it doesn't take much. We're not talking about huge amounts of exercise. We're talking about a little bit of movement, and how powerful that is and how much better it helps you feel. So when you have cancer, when we think about exercise with cancer, the priorities are slightly different. And we need to reframe exercise as something related to health. So remove everything to do with aesthetics and how you look. And it's really around your health. So we need to think about it as this kind of extra treatment in our armory, right? So the specific exercises to do after surgery, particularly around abdominal stuff. So we need to reduce our risk of hernia, particularly if you've got a stoma. But we need to look at how to rehabilitate the abdominal wall. So in the classes I do with Overcome, we do 20 minutes at the end where we're doing some clinical Pilates, and those exercises are specific for people who've had abdominal surgery. We've got this thing about muscle mass, and this I bang on about all the time, but it's so important to reduce your risk of things like osteoporosis, because when you've got a hormone-related cancer and, you are possibly pushed into early menopause as well, we need to think about our bone density and our bone health, as well as muscle mass. So those two things together are helped by, guess what? Exercise and strength training. Reducing our risk of lymphedema, that's more so in breast cancer patients, but even so, if you've had any lymph nodes removed from your groin, you may have a risk of lymphedema in your legs and your limbs. So it's actually still really important aspect, and exercise is very powerful in reducing the lymphedema risk. Manages and reduces fatigue, which a lot of people think, well, hang on a minute, exercise is tiring. How can that make me feel better? What we know from the research, and what you probably know if you've tried it yourself, a little bit of movement actually is energizing, but it needs to be the right type and it needs to be the right intensity for you to feel energized rather than fatigued. It can help you mentally cope with treatment, but it can also physically help you cope with treatment and surgery. So if you're a bit stronger going into any surgery you might be having, you're going to have a much better outcome from that surgery. Helps you rebuild your confidence, your body image, and your mental well-being, and it improves quality of life. And part of the work that I do is with our local hospice, and I'm working with patients who are on a palliative treatment pathway, and we know from the research from that group of patients that it actually extends life as well. So, you know, there are many, many benefits, particularly for anyone with cancer. But we need to think about, so this is what I asked you about, what is exercise? What is your perception of exercise? We need to think about it in the bigger scheme of things. So we need to think about just general movement, the way in which we move our body. Now that can just be walking around the house, going out for a walk, doing some housework, doing some gardening. We're moving our body in some way, shape or form. Now, what's happened over the last 20, 30 years is a lot of that movement has been taken out of our daily lives through working on computers, having household appliances aid us with movement. So a lot of that movement has been taken out. Physical activity is slightly different. So that's a little bit more, where we're actually getting a bit of a benefit from movement. And exercise is more structured. So we kind of need to think about exercise as part of movement. So people often are scared of exercise because they think it means going to the gym, going for a swim, doing something very specific, and it doesn't have to. We get benefit from movement, and we get benefit from walking, pottering around the house, and just not sitting still. So that whole kind of thing, I want you to just rethink what you think about exercise. So let's just look at some of the components of exercise. We've got lots of different aspects of it. We've got cardiovascular, which is what most people think about when we think about exercise. So we think about getting our heart rate elevated a little bit, feeling a bit breathless and a bit sort of out of breath. So things like brisk walking, a little bit of jogging, running, swimming, things that are sort of continuous that might get our heart rate up a little bit. That's kind of cardiovascular, and that's really what we're talking about, but it's 150 minutes of moderate exercise. However, there are many other aspects to exercise and movement. So we've got things like strength, and with strength, we're talking about using something to create resistance. That might be a TheraBand or our body weight or actual hand weights. So things like Pilates and yoga, but also things like carrying shopping, doing some housework, gardening and DIY, where we're using our muscles and working against a bit of resistance. That for me is the most important component for anyone with cancer. So using a TheraBand, using weights, we need to rebuild muscle, and we need to reduce that risk of osteoporosis and bone density loss. Mental well-being, so anything that makes you feel good. I don't care what you do if you feel good. I went round to see my mum yesterday and she was busy dancing to Kenny Rogers. She's 80 and she'd been knitting, and she said, I've got to stand up. So she was dancing around a living room to some Kenny Rogers country music. Brilliant. She just put it on and she just got herself moving. So anything that makes you feel good. And that might be fresh air, green space, music, being with friends, but also kind of mastering an activity and building your competence in that activity can really build your confidence and mental well-being as well. There's really nice feeling about, actually, I'm doing this exercise better than I was doing it last week. Flexibility, this is the stretchy stuff, so how well you can reach your toes or how well you can reach up into a cupboard. And that actually comes with strength. So as we lose strength, we also lose flexibility. And then we've got this component of balance, coordination, agility. So anything that improves movement is going to improve that section. So this is where we're risk of falls, because we've lost our muscle, but we've also then lost our balance and coordination. And so anything you do is actually going to improve that as well. So those are kind of, and with our class at Overcome, we cover all of that. So we do a bit of everything. But let's talk about fatigue, because fatigue is one of the big barriers to exercise and movement and kind of just getting out there to do anything when you've got cancer. And we have to think about this really precious piggy bank of energy. So I want you to put your energy in a precious piggy bank and you protect that piggy bank of energy. And when we are going through treatment and we're having surgery, that piggy bank becomes even more precious. So we need to think about putting energy in, and we need to think about the things that drain it, because those are going to be different to perhaps they were before cancer. So you might want to come back to this later and make a little list. What are the things that give you energy? What are the things that drain your energy? And, you know, things like, if you look at the thieves, these are mine, shopping at the supermarket, socializing and going to dinner parties. I actually find that really exhausting. Anything more than sort of one-on-one, I find really tiring. Not everybody does. Having any kind of long car journey or commuting, drinking alcohol, and housework and cleaning. Those are the things that I find draining. So I want you to make your own list, and that might be different. But things that give me energy are things I know I need to prioritize. So going to bed really early, getting into bed for 9:30 with my book and a cup of tea, that for me is really important. So I make sure I get organized during the day so that happens. Things like I found using a recipe box for dinner, just that simple switch has just taken the pressure off for me, and it's been really powerful. I don't really like doing it, but actually what it's done is it's freed up a lot of mental energy. It means my husband or my kids can cook, and it's just taken away some of that stress. Having a soak in the bath, going for a walk with the dog, or doing some Pilates. So things that give me energy, things that drain my energy. But my energy is very precious. So we need to put a bit more priority on that, because if I don't do those things, I then don't have enough energy to think about exercise. So it's about prioritizing your energy to enable you to be active. And that's kind of a slightly different way of thinking about it. So thinking about kind of planning, pacing, prioritizing, and the things you need to do. So think about planning. That's the going to bed at 9:30, getting a recipe box, and prioritizing what's important to me. Now, what's important to me is exercising. So if I get invited to a dinner party where I really don't want to go, I know that I'm not going to enjoy it. I'm going to be with people I don't really know that well. That is going to exhaust me and probably wipe me out for a couple of days. So for me, I might decline that invitation because I know that for me, it's not a priority. So it's about prioritizing all these different aspects so that you can do the things that are important to you. Let me just check time. I don't want to go too long. I want to make sure I've got lots of time for questions. How am I doing? Okay, so let's talk a little bit about different types of motivation when it comes to exercise. So what I hear from a lot of people is, I'm not motivated to be active. I struggle to get motivated. When you are unwell or when you're having treatment, that motivation becomes even more tricky to find. So I want to talk about what actually we mean about motivation. So we've got two types. We've got intrinsic motivation and we've got extrinsic motivation. Extrinsic motivation is the kind of what we think about normally. So you might go along to an organized group. You might sign up for an event. You might go along to something with its facilities. You might be affected by the weather. There might be some competition involved. You might get a medal at the end of it. And it's maybe a goal that's been set by somebody else. You might have a fitness trainer or somebody actually setting the goals and targets. Extrinsic motivation is great, but it doesn't it's not a sort of long-term motivation to tap into. What we need to try and learn is to be a little bit more intrinsically motivated. So that we're exercising because we actually like it, because we enjoy it, because we are connected to that activity. We get something from it. And there's a satisfaction and happiness and pleasure. And we're really kind of learning something about ourselves with that. So when we talk about exercise, one of the things that I'm deeply passionate about is not exercising too hard. So what people do often is they'll go and do something and it's too challenging, it's too difficult, they might push themselves too much and they're not enjoying it. Our brain needs to associate movement and exercise with enjoyment and pleasure. And if we're not, our brain will tell our bodies that we don't want to do it. So then we become less motivated. So during the pandemic, people who are more extrinsically motivated, so people who were maybe looking for races, they were looking for going to the gym, they were going to organized events, their motivation fell off a cliff edge. People who were more intrinsically motivated, they just went out because they enjoyed it. They were learning about themselves. They just enjoyed being out and about or doing something. They stayed on track with what they were doing. So what I want you to try and do is tap into some of these intrinsic motivations rather than focus on extrinsic. We sometimes need to do a bit of the extrinsic stuff to get us to the intrinsic, but think about what you get from that activity you're doing. And it doesn't matter what it is. It might just be pottering around the garden. It might be going for a walk, but actually really being mindful about that and tuning into that. So shifting towards this intrinsic motivation, find an activity you enjoy. What do you really love doing? Don't do something you don't like, because that's not going to last, you know, like be like my mum, go dancing to Kenny Rogers. And we need to start gently, because if we don't start gently, we knock our confidence. So by starting gently, we build our competence and we build our confidence. Now, if you are feeling unwell and maybe you were active before your diagnosis, everything's changed. So now the things you used to do and the level you might have exercised at before is now completely different. So we need to draw a line in the sand and start all over again. You almost need to start like a beginner again. So you rebuild your competence in your ability and your confidence in your body. And we just take it right back. So often I say to people, you reduce, if you were fit maybe before your surgery, before your diagnosis, you reduce that by 70 to 80%. And that's how little you start with, and you build from there. And I've been there, I know how hard it is. And you feel like I am doing nothing compared to what I used to do. And that is really hard, but we build that back. And understand the purpose, you know, why are you doing it? And I'd really encourage you to focus on health and health-giving benefits of movement and exercise, and start to tune into enjoyment of that process. And find something that's achievable. It's not too easy and it's not too hard. We don't want it to be too difficult, because if it is, your brain is going to stop you from doing it and you're going to go, you know what, this is too difficult. If it's easy, if it's too easy, you don't feel like you're getting a benefit. So you need to find that little sweet spot. So overcoming these barriers, find things that give you joy. It does not have to hurt. Exercise should nourish you, not punish you. So if you're just doing 10 minutes of something, I don't care what it is, that is brilliant. You know, don't get too hooked up about the 150 minutes business. 10 minutes of anything is brilliant. Movement, that's all we're looking for. Find an environment where you feel safe, particularly post-pandemic, and also just from a safety perspective, but find an environment where you feel safe to be active. And at the moment, that still may be in your home environment. So come and access the classes, or find other online services that you feel you can access safely. And maybe find an exercise buddy, so you've got some kind of accountability. And again, that's great with the classes. You sign up, you come along, there's a kind of a time and a place and a commitment. So that accountability can be really helpful. And understand your why. Why are you doing it? What are the reasons and what are the benefits? How do you feel before? How do you feel afterwards? So we're tapping into that internal intrinsic motivation. build your confidence and your competence, so your ability to do it. And that feeds back. So once you've built your ability, that feeds back to your confidence, and that starts to grow. So it's like a little circular system. And ditch the guilt. I would love everybody to ditch any guilt they have about not exercising in a particular way. We just want you to move in any way that feels good for you. So the importance, if you've had surgery, and almost everybody with ovarian cancer does have surgery, and some people have extensive surgery and some people have stoma bags. And I've had 5 abdominal surgeries and 3 different stoma surgeries. So I am really bang on about the importance of core rehab after surgery. It's not talked about. It's not talked about nurses. It's not talked about by surgeons, but it is incredibly important. So some kind of step-by-step rehabilitation, clinical Pilates, like postnatal type exercises. I've got resources you can access through me. Just Google me, find me, or come along to the Overcome classes where I'm teaching the clinical Pilates there. But we start with this, 3 or 4 days after surgery, just with diaphragmatic breathing, with core pelvic tilting, little tiny exercises, and build up your strength. So, hashtag and make it happen. Let's just have a think. You might want to come back to this later as well. So you might want to sort of jot down, this is kind of how we can overcome these barriers. So what is it you want to do? Think about your why, think about an activity. Let's say, for example, you want to come along to the Overcome class on a Tuesday morning at 11 o'clock. So right, I'm going to do that. What do you need to do in order to make that happen? So you're going to need to make sure that you've got access to the computer and it's set up and you've got space around you, and you need to book it. What might get in the way? Well, kids might get in the way, the dog barking, there might be some other Zoom call, I've got some work. There might be somebody else wanting to use the computer. What obstacles might you face? So we start to work out what obstacles we might face ahead of time. How might you overcome those, and who can help you? So it might be a simple case of asking someone else within your household to help you, or even join up with somebody you know, maybe from this forum, who also wants to come along to do the class. How will you benefit? What will you love about it? How are you going to feel afterwards? You're going to feel great. You're going to feel like you've done some movement, some exercise in a safe way, and you're going to feel really good about your body because you're going to start to feel more confident and stronger. And what's your why? Everyone's why is going to be different, and just focusing in on that can be really powerful. So we make a realistic plan. We keep it simple, we break it up, we keep it small, and that you can apply that kind of step-by-step approach to absolutely anything that you want to try and achieve. And it can be really small, like a 10-minute walk. And I know what it's like, you get up in the morning, you think, right, I'm going to go for a 10-minute walk today. And then you start pottering around, you might go on the internet for a bit, something might happen. And then it gets to sort of 4 o'clock and you still haven't done that 10-minute walk. So we have to put a plan in place to make something happen. Find your mojo. So if your mojo's disappeared alongside the pandemic and your diagnosis, we need to try and find it again. So we have to have self-compassion, no guilt about anything to do with exercise and movement. So I hear people all the time say, I can't do what I used to do, or I'm just not motivated. And the more we tell ourselves those messages, the more we believe them. So we ditch the guilt and we have compassion for our situation and how we're feeling. And we acknowledge those difficulties and we share them. And it's okay to say, do you know what, I'm finding this really hard. Who can help me? How can I reach out for help? And where can I get that? And most importantly, we need to build our fitness and build whatever we do, and gently and safely. And that then feeds into our confidence. So 2 little phrases that I really love, particularly for people who are living with cancer. When you feel like exercise the least is when you need it the most. So those days where you feel absolutely grotty and you think, you know what, I can't even get off the couch. Okay, you may need to spend a day on the couch, but I bet if you get up and just do a little 5-minute walk around the block, or a little 5 minutes of just stretching and moving, you're going to feel a lot better. And that's the time when you need it the most. And exercise should punish you, should not punish you. Exercise should nourish you, not punish you. And that is my kind of absolute sort of, real catchphrase, because I think it's so important. And unfortunately, society and social media is full of messages around exercise being hard and sweaty and punishing. And we need to shift that mindset rapidly for everybody, but particularly when you're dealing with cancer. So I want you to think about exercise and movement as this kind of nourishing part of your treatment package that is going to really benefit you and help you. And then there's this little thing which I found on the internet. I don't even know who wrote it, but it's a lovely little poem. The more I walk, the better I feel. The better I feel, the more I heal. The more I heal, the more I can take. So let's get moving, for goodness sake. And I just love that. I think it's just really powerful. And so there we go. Any questions? I'm going to stop sharing, and then I think there's loads of questions that have popped into the chat. I don't know if someone's going to ask me questions.
Thank you so much, Sarah. That was a brilliant presentation, extremely informative, and there's already been lots of very positive feedback on the chat. People have found it really helpful. So thank you so much. And we have had several questions that have come through. The first of which I will just read out as it's someone giving a bit of information about their own experience, saying, I had a congenital heart defect and unfortunately chemotherapy severely damaged me, as at the end of the treatment a blood clot formed in my aortic valve, giving me stage 4 heart failure. In 2019 I had open heart surgery and had a pulmonary valve replacement. I walk every day, but have been told that Pilates isn't suitable for me, so I'm not allowed to lift heavy shopping or lift anything heavier than a cup over shoulder height. I wondered if you had any thoughts on that, please.
Okay, so what I would if you were a client of mine, what I would do, I would go back to the consultant who gave you that advice, and I would want to know why they've given you that advice. Is there a specific reason? And then start from there, because there may be a specific reason. Generally, when you've had the valve replaced, you should be able to return to relative normality through cardiac rehab and through relative normality of exercise. So it may be that those restrictions around not lifting heavy things were intended for a shorter period of time post-surgery. I don't know. Okay, so that's often what people hear, is they hear that restriction, but actually that is meant maybe only for the 3 months post-surgery. So first of all, I'd want to know why that advice has been given. And what the reason is behind it. But also with regards to, I walk every day, but I've been told Pilates isn't suitable for me. We have Pilates and we have Pilates, right? So there's very high level Pilates, and you see that's your kind of classic class you might see on YouTube, and that is very challenging, tough stuff. What I teach is rehab Pilates. So this is focused on breathing. If you can get in and out of bed, you can do rehab Pilates. It's physiotherapy-led clinical Pilates, completely different. Okay. So it's unpicking why you've been given that advice, trying to understand it. Was that just meant to be a short-term piece of advice and with a return to normality, or is there something else going on? And also, clinicians are often very nervous about exercise because they don't really understand what we're doing. So we need to reassure our other healthcare professionals to say, look, this is what we're doing with this person is safe, it's appropriate. They often put a blanket cover on things about not doing stuff because actually that's safer than someone going off and doing something too hard and challenging. However, if you're supervised and it's safe and appropriate, then I wouldn't see a problem with you doing that. But, you know, I'd want to go back to the sort of surgeon and find out a little bit more about why they said that. But generally, I like to see people getting back to as normal life as possible. Those restrictions are often meant just in a short term.
Thank you, Sarah. That's great. Thank you very much. The next comment that's come into the chat box is someone who said, my body definitely doesn't feel the same after having a hysterectomy and chemotherapy. This is something I'm still coming to terms with. I never thought I'd have to think about how long I can walk, exercise, etc. I try to walk every day and would like to get into more strength-based exercise, weightlifting, yoga, or Pilates. So just wondered if you had any advice for that.
Brilliant, thank you for sharing that. And you're right, you know, when we've had abdominal surgery, and I know what that feels like, you know, I've had 5 surgeries myself and three stomas, and your body is completely different. You feel almost disconnected from it, and you think, how am I even going to move again? So what I talk about, the importance of core rehab, is that forms the foundation of putting you back in touch with your body and learning about those really gentle early movements which are safe and appropriate to restore your confidence. And that starts with things like diaphragmatic breathing and pelvic tilts and stuff which starts to rebuild your confidence in your body again. And that then has this, we put that building block in place, and then we can build on it and we go from there. So often people have their surgery, they have their treatment, and they're floored, and they try and do something which they did before, and that just feels so difficult and so alien because their body now doesn't work the way it did before. And mentally we've lost trust in our bodies as well, because now suddenly we're dealing with this diagnosis, and what on earth's that all about? And I don't even trust my body anymore. So by the process of exercise and rehabilitation, we build physical reconnection, physical strength, but also mental confidence. The two things go very much hand in hand. So I would say come to the class if you can, the 11 o'clock class on a Tuesday, and you'll get all of that from there. And it's safe, and there are lots of options. So you listen to your body and choose how you progress through that.
Wonderful. Thank you, Sarah.
I hope that answers that question. Yeah.
Thank you. The next question we've had come in is asking, what do you think about rebounding?
Oh, interesting. Well, there's lots of benefits for it. It's fun. What I'll say is, if you've had hysterectomy and you've had any pelvic floor surgery and you are in menopause, rebounding can put a lot of pressure on the pelvic floor. So I would probably be quite cautious about rebounding just from that perspective. Or make sure you've done enough rehab before you go rebounding so that your pelvic floor can tolerate the load of rebounding. But if you are strong enough and you have done your rehab and you build it up nice and gently, then it can be really fun, and there's a lot of benefits for it. So, but yeah, it wouldn't be a starting point. I'd want to make sure you've done rehab, core rehab first. And if you've got any pressure through the pelvic floor, then stop. Make sure you do your rehab and then try again a little bit later on.
Excellent, thank you. We've then had another question come in asking what strength-based exercise you would recommend for the prevention of osteoporosis. Okay, so basically anything at all where you are working against some kind of resistance. So if we look at the World Health Organization guidelines, they're literally talking about carrying heavy shopping bags and carrying, lifting heavy things. Now, often after surgery, we're told not to lift heavy things. So the two pieces of advice are quite contradictory. That advice is really only meant for the sort of early days post-surgery, because what we want is to get people back to lifting and using resistance. So what I say is, once you've recovered from any surgery you've had, we need to start getting you using your muscles. So strength resistance bands, hand weights, cans, bottles, anything. So that's what we do in class. But equally around the house, you can just sit there. My mother-in-law had heart surgery earlier this year, and she used to just sit and watch Coronation Street with some dumbbells in her hands, just kind of coming like this, little mini bicep curls. Things like that are brilliant. Things you're doing around the house, you link it with another activity. So calf raises whilst you're waiting for the kettle to boil, mini squats when you're waiting for the kettle to boil, bicep curls with weights when you're watching telly. All that kind of stuff is great. We also just do it in class, but anything
where you are doing some resistance exercise. Now, osteoporosis particularly is responds well, or reduction of osteoporosis risk responds well to anything which is a higher impact exercise. So jogging, anything where you are bearing your own weight is really good as well. So swimming and cycling, unfortunately, are not great for osteoporosis. We need to be weight bearing. So jogging is one of the best things for that, if you can. That said, I'm not saying don't cycle and don't swim, because they are brilliant exercises themselves, but we need the strength stuff too.
Thank you very much, Sarah. The next question is linked to this.
Oh yeah, I've just seen that.
Well. Yeah, just asking, I've been diagnosed with osteoporosis age 40. I jog 3 times a week. Is there any exercise I should avoid?
If you have been told you're at risk of fracture, then the things just to be a little bit careful of, particularly with the spine, are any kind of rapid torsion movement. So that would be things like, maybe if you imagine a tennis serve or a golf swing, where they're rapid, they're fast, and there's a lot of torsion and twisting going on through the spine. There are certain exercises in Pilates where you might want to be a little bit more cautious if you have been told you're at risk of fracture. But osteoporosis benefit can be improved, and by exercising and jogging, you're doing absolutely the right thing. So carry on doing that, that's brilliant. Weight bearing exercise, you can really improve your osteoporosis diagnosis with weight bearing exercise and strength training. So really, unless you're at high risk of fracture, the only things to kind of be a little bit more cautious about are torsion and twisting and rapid movement. But other than that, try not to be nervous and try not to worry, and actually just get on and do as much as you can.
Thanks, Sarah. The next question we've had come in is asking, is there any difference between resistance bands and weights?
Well, yeah, I mean, if you've got, you can go much heavier with a weight. So, you know, if you've got some dumbbells or a kettlebell or a bar of weights, then you're going to get a much heavier weight eventually. But in the early days, a resistance band is great for creating just some resistance for your muscles to work against. If you're using a very lightweight, say a 1 or 2 kilo, and a resistance band, they're going to do pretty much the same thing. I would just encourage you to do either or both, or mix them up. As you start to get stronger, a resistance band won't have that much effect. It's more of an early stage tool. As you get stronger, you're going to probably want something a little bit heavier, but certainly initially it's brilliant. So mix it all up. I still get a benefit from doing resistance bands. You'll need to do quite a lot of it eventually, but you still get a benefit from it.
Lovely stuff. We've had someone share, I recently signed up for a walk 100 kilometres with my dog from Macmillan. It's definitely challenging me and pushing me to walk more. However, I found my ankles and feet have been aching, and was thinking maybe I need to stretch more before and after. Okay,
brilliant. Well, first of all, fantastic. Well done. Keep that going. That is really good. And things like that can really help you be motivated to stay on track and get out there. So that's great. Well done. There's all sorts of reasons for achy ankles and sore feet. It could be choice of shoes. It could just be the muscles getting used to it. It could be, so make sure you've got the right shoes. That'd be the first thing. So make sure you've got the right trainers or the right walking boots, and you're not doing it in kind of floppy wellies that you're really having to hold onto your foot, or heavy wellies that that's often a thing. So make sure you've got some good walking boots or some good trainers. And stretching is a little bit of an interesting one. So we need to probably stretch a lot less than we think, and actually strength is one of the most important things. So I would probably throw in a few calf raises to try and strengthen your calf muscles and the muscles around your ankles. So do some calf raises while you are boiling the kettle. Maybe try rolling a ball under the sole of your foot. That's really good also for peripheral neuropathy. And if it continues, then maybe go and see a physio and just get some exercises to do, if you can do that. So yeah, but hope that helps.
Wonderful, thank you. Now this one I think might be a signpost back to the clinical team, but I will share this one with you, Sarah, as this question's come back in. I've had 3 abdominal surgeries, the last being stoma reversal, 3 months on, surgical wound reopened due to internal infection, done no exercise, no lifting, did some gardening, and have had stomach pains for the next few days and diarrhea since. I don't trust my body and need advice.
Okay, so I think there's a lot there to unpick. I think the first port of call is just going back to GP, surgeon, if you're still under surgical care, or maybe even still make contact with your stoma nurse if you still have contact with them. They still should support you after reversal. You need to understand what, unpick, is the stomach pain diarrhea related, or is it muscular? And those are going to be different. So it's trying to tune into actually what is going on. And, what we find, so the diarrhea may just be a big red herring and there's nothing else going on at all. And that might just be post-reversal and your bowels just settling down again. The stomach pain, the discomfort may be from lifting too much without having done any exercise or rehab before that. So I would say unpick that, back to the stoma nurse, find out some advice about the sort of diarrhea. That might be a post-reversal issue. But then look at whether you need to do some core rehab to kind of give you that confidence and strength back in your core before you start lifting anything. So I would really encourage that. So come to class where you'll get that, or look me up, and I've got some specialist stoma classes that I do online as well.
Thank you, Sarah. And also to the person who asked this question, if you wanted to speak to anyone on the support team here at Overcome, please do give us a call on the support line. And I'm just seeing to see if anything else has come through. It's been lots of great positive feedback. People have found the session very motivating. So that's really great to hear. And I think that was all the questions. Please do drop your question in again if I've missed anyone. But thank you so much, Sarah. It was all
I just noticed somebody put they don't trust, well, there's 2 things I just want to pick up on. I was looking through the chat. Somebody said they don't trust their body anymore, and that's absolutely normal. And that's why we need the process of rehabilitation and exercise to rebuild that trust. It doesn't just come back. It's about learning to move your body in a different way and learning to live in your body, in a different body that now feels very different. And that's normal. And I have huge empathy for that because I've been there. But what I will say is a little bit of movement and rehab will help you rebuild that trust back in your body, and you start to learn what it can do in a different way. And there's another, somebody just said, feeling intrinsically motivated, about thinking about exercise as being anti-inflammatory. So there's your why. If we think about the biological, physiological reasons why exercise is so important, we're thinking about it almost as this extra treatment. It's anti-inflammatory. There is research to show that exercise for people with cancer diagnosis, you are reducing your risk of recurrence. You're also extending life. So if those are your whys and you tap into those, and they're really powerful whys. So focus on those. Brilliant.
That's wonderful. And lots of people interested in joining the exercise
group. Come and do the class. It's so fun.
That's really encouraging. And we also have a 5-week yoga course starting with Overcome. We've still got a few places left for that. So we've dropped that into the chat, as well as Holly has also popped in about our Walk With Me group, our Overcome walking group, virtual walking group. So there's some information in the chat there too. But thank you ever so much, Sarah. Unless there's no other questions at the moment.
I've had one. I've had a question in here if we've got time for that.
Sure.
Yeah.
It's about cold water swimming. Someone asking, what are your thoughts on the value of cold water swimming, both in just a costume and when the temperature drops, a full wetsuit with gloves, socks, etc. Swimming has helped my lymphedema, and I'm wondering if the cold adds other help.
So I don't know that much about cold water swimming. I don't do it myself, but I know a friend of mine who runs a group. And I see the huge benefits that women, particularly menopausal women, are getting from cold water swimming. There are huge physical and psychological benefits. I would say that it has a massive impact on lymphedema, so in a good way. And I think it probably has huge benefits. But I do also know that you need to build it up quite slowly and gently, particularly if you're going in without a wetsuit. So particularly now, it's gone really cold in the water. So I would imagine it's very small exposure, short amounts of time, make sure you've got everything in place afterwards to get warm, all those sort of safety things. So I'd make sure you check all of that out first. But I would say if you are finding it beneficial, then absolutely go for it, because I know that so many women do, and it can be hugely powerful. So, and this is what I was saying about finding something you love. You might not love it at the time, but apparently it's like there's a massive kind of exhilaration afterwards. So I think that's probably a really good thing. So yeah, go for it. Build it slowly, get some advice about making sure you stay safe.
Excellent. And I think that brings us right up to our 12:30 finish. So perfect timing there. Thank you, Sarah. And I think we'll be joining the rest of the group very shortly. But I'll wait on the call in case anyone gets stuck reconnecting. Thanks again, Sarah. That was great.
Pleasure. Thanks for having me. Thanks, everyone. Bye.